So, good afternoon, ma'am. I'm Alyssa Kaye Dacanay from BSN-II-IMOGENE, and for today, I'm going to demonstrate the 12 leads ECG. So, to start with, I'm going first to review my client's medical record and plan of care for information about my client's need for ECG. And then next is we're going to keep our clients away from objects that might cause electrical interferences like equipment, fixtures, and power cords. So, inspecting the surroundings, we need now to inspect the client's chest for areas of irritations, breakdowns, and excessive hair because these things can interfere with our electrode placement. So, first, we need to ask for permission, especially if our client is a female, because we're going to expose some of the private areas. So, Mom, may I just strip out your shirt because I'm going to inspect your chest. So, after inspecting the chest, we're now going to assemble all our equipment that we're going to need for us to save our time. So first we need the ECG machine with electrodes in it. So let's just assume it's the ECG machine with electrodes. And then next we also need the electrical gel. Then let's assume this is the extra trace sheet if ever that our machine runs out of the sheet. And then also need the gauze. So for example, this is the gauze we're going to use later on. So, and now we also need to verify our client's identity for us to know that we're attending the right client. So, ma'am, what is your name? So after the client tells his or her name, we also need to check for the client's identification wristband. So after verifying it, we also need to explain to the client the purpose of the ECG. So ma'am, I'm going to perform the ECG. This is for us to know the electrical impulses or conductivity of your heart to determine the condition of your heart and detects if there's any abnormalities. And mom, do not worry because these electrodes that I'm going to attach to your body will not cause any electrical conductivity, so you won't feel anything at all. So after explaining to the client, we need now to perform hand hygiene for us to reduce the transfer of microorganisms. And then after that, we need now to plug also the ECG machine to the wall outlet. And then we also need to place the ECG machine next to the client, close to the bed of the client. And then after that we're now going to provide privacy for the client. So yes, after providing privacy for the client to avoid embarrassment, we're now going to place our client in a comfortable position. So a supine position might do, and then we're also going to instruct our client to put his or her arms on his or her sides, and then the feet in the legs will be slightly apart. And then after that, we also need to instruct our client to stay still in the bed and avoid talking while doing the procedure for us to reduce electrical artifacts. So then after that, we're now ready to attach our electrodes. So first we're going to attach the limb electrodes on the client's extremities while the client is lying flat on the bed. So First is we're going to attach this color red. And can you see it? Color red. Color red are electrocode to the client's right arm. So red for the client's right arm. And also going to put electrogel. So for example, it's the electrogel. Then next is we're now going to put the yellow electrocode, which will be put on the left arm of the client. So this is the yellow electrocode. Nakita mo ba? Ma-zoom in. So yes, this is the yellow electrocode. Ay! Yes, this is the yellow electrode. Basta yellow electrode on the left arm. And then next, for the leg, we're going to use the black electrode for the right leg. Here. And then also going to put the green electrode for the left leg. So next, we're now going to put expose now the chest part, the client. Again, we need to ask for permission because we're now going to attach the precordial to the client's chest. So next is I'm going to strip up your shirt because I'm going to attach this electrocode in your chest and we need to put it intact with your skin. So there. Ma'am, i-side ko lang for you to see. There. Tama ba? Hindi mo kita. There it is. Now exposing the chest part of my client. So first we need to put the V1 or the first electrode, which is color red. Color red for V1, and we're going to attach this V1 on the fourth intercostal space at the right part chest of the client. So we need to palpate for the client's prominent part of the sternum. Then we're going to slide our finger to the right because that indicates the second grip. So we're going to palpate down until we reach the fourth intercostal space. This is the third one. This is the fourth one. So we're now going to put now the V1 on the fourth intercostal space near the sternum borderline. There. Fourth intercostal space. Here. Ma. Hindi ko hindi makita. There. And then next, we're going to put now our second electrocode, which is the V2, that is color yellow. So we're going to put this color yellow or the V2 on the fourth intercostal space too, but on the left side of the chest. So again, I'm going to palpate. This is the second grid down to the third intercostal space and then down to the fourth intercostal space. So again, you also need to attach the V2 close to the sternum borderline. So proper attachment and proper color coding of this codes is very important, because if we do not follow the proper attachment of this with its color coding accordingly, we're going to end up having a wrong result. So proper coding and placement is very important. So yan. Going now to place our V2 in the fourth intercostal space near the border line. There. Near the sternum border line. The left part. And then next, we're now going to attach now the V4, which is the color brown. This is the V4, color brown. Let me see it, mom. It's not color brown though. Color brown. Yeah. The V4, which is color brown, we need to attach this first before the V3, because V3 will be located at between V4 and V2. So for us to know the location, for us to know the detachment of this V2, Sanpai. V3, we need to put first our V4. So V4 is located at the fifth intercostal space to the left chest. So again, we need to palpate for us to be easily locate the fifth intercostal space. It is located mid-clavicular line. So we need to know the both end of the clavicle and then to the center of it, and then slide down. Then palpate for the fifth intercostal space. 3, 4, 5. Here is the fifth intercostal space. So mid-clavicular line, there, fifth intercostal space. So basically it's just below the nipple. So we're now going to put the fourth lead or the V4. There. Fifth intercostal space, mid-clavicular line, here. There. And then next, after putting the V4, we're now ready to put the V3, which is, again, as I said a while ago, just between V2 and V4. There. And then next is we're now going to attach the V5, which is the color black. Color black V5. So the location of this V5 is at the anterior axillary line, which is, we can determine it by knowing the mid-axillary line and the mid-clavicular line. In between of it, the center of it is now the anterior axillary line, and then we're just going to slide our fingers down until the level of V4. So here, space. So we're now going to put it level of V4 at the anterior axillary line. There. And then next, for the V6, we're going to put this V6, which is color violet. Ano nakikita mo, ma'am? V6, color violet at the mid-axillary line. So this is our mid-axillary line. Then we're going to slide our fingers down until we reach the level V4. There, we're going to place it there. Again, V6 is located mid-axillary line level of V4. There. There you have it, ma'am. Ma'am, isn't ko lang para makita mo. There you have it. V1 for the intercostal space, right side of the right chest of the client. Then V2 yellow, V3 green, V4 brown, V5 black, and V6 violet. So that's, and then after that, ma'am, we're now going to turn on our ECG machine and plug in the ECG machine. Do not forget to properly ground the machine. And then we're going to turn the ECG machine, turn on the ECG machine and obtain the trace. So here is the trace. So after obtaining the trace, we're now going to keep it for a while, because first we need to detach these electrodes from the client. So first we're going to detach the electrodes at the chest part of the client, because it is the exposed area. So then we remove it. There. After removing, we need to wipe the chest of the client with the gauze, because it is stained with the electrogel. For example, this is the gauze. After that, I'm now going to put back the client's shirt, and then also going to remove the electrodes from the client's extremities. This. Again, also wipe. So the feet. So there, after that, we're now ready to document and write significant data about the client, like at the back part of the client's strip, the back part of the trace sheet. So we're going to put the client's name, the date, time, sex, age, and the vital signs. So after that, already done the ECG procedure.